So for diabetic foot care, the biggest things that concern us as a foot doctor, the fact that diabetics tend to have neuropathy, which is a condition which patients lose sensation in their feet, especially the pain sensations. Pain is there for a protective threshold, and if you can't feel pain, you may step on something in a carpet tack or things like that, and you don't know you ended up stepping on something until there is a problem such as an infection or an ulcer. And it's much easier to catch these things early than it is later. That is why we typically recommend every 3 months our diabetic patients come in, we check their feet, we trim their toenails if they need it, we trim any callousing that may be present, because calluses indicate a pressure point which may turn into a problem somewhere in the future. So the biggest thing, like I said, is just the maintenance. Inspect your feet daily. Typically I recommend my patients keep a mirror next to the bed so they can, when they sit on the edge of the bed, they can just hold each foot over the mirror and they can see the bottom of their foot. That tends to be where most of the problems occur, because they can't see or feel the bottom of their feet. So daily inspections are very important. Keeping your blood sugars regulated are also very important. The higher the blood sugars, typically the worse the symptoms from diabetes are. So keeping the diabetes, the blood sugars, the A1Cs, all of those things under control are very beneficial and will help to prevent more of the long-term ramifications of diabetes. The shoe gear is important. With a lot of insurances will allow you to have a pair of shoes and diabetic inserts every year. The inserts are made out of a softer material and they mold them to they're molded to your foot, so it's less likely to cause problems with the pressure points and the callousing and things like that. So other than that's as far as maintenance goes, that's probably the main targeted points for taking care of your feet as far as being a diabetic. As far as the dry skin that is usually associated with diabetes, any moisturizing cream or lotion will work. We typically recommend patients not apply the lotion or the cream or the Vaseline in between the toes. Anywhere from the base of the toes back is perfectly fine to use creams or lotions, because the diabetes will tend to dry out the skin. So constant lotioning on a regular basis is very important for diabetic skin. Once a day application of the moisturizing medium is usually plenty, as long as it is consistent. If there is a day that you cannot apply it, it's not that big of an issue, as long as you're relatively consistent with the use. As soon as you stop using any kind of lotion or Vaseline, it's going to dry back out. So there's no way to overturn the results of that. It's just strictly maintenance. So in closing, the main points are: inspect your feet daily if you're a diabetic. Report any changes, no matter how small. The problem areas that will arise are much easier to treat if you catch them early. Make sure to wear good shoes, diabetic shoes if possible, to help prevent any pressure points, callousing, ulcers, or any other skin abrasions that would result in any further problems, because diabetics tend to fight off infection less than a non-diabetic. So a small abrasion can turn into a large problem if not treated properly. So definitely report any changes, any problems to your primary care doctor or to your podiatrist as soon as possible.